Hi everyone, it's Dr. Stephanie Wu from Wu University, and it's time for some Wu U wisdom. I had the pleasure of moderating day one of the Keratoconus Symposium, and I wanted to just go over a few of the key takeaways from the day. So first we started off with Dr. Mitch Ibach, and some of the key takeaways are that it is incredibly important to refer patients early when you diagnose them or suspect them with keratoconus. He also reviewed a lot of different options that we have in our own practices without high and expensive technology that we can use to diagnose keratoconus patients. If you see a patient that has a high amount of cylinder in their refraction, or they cannot get to 20/20, or they just have some steep Ks, those are just all kind of things that we all have in our office that we can look for and say, hey, this is kind of a strange case. Let's get this patient referred for a topography to see if they do in fact have keratoconus or if they're at risk. Next, we heard from Dr. Kent Wellish. He is an ophthalmologist that performs cross-linking on a lot of patients, and he went through a lot of the dry eye issues that a lot of patients have when they undergo corneal cross-linking. So he went through a lot of different treatment options for patients that happen before they actually have cross-linking surgery done, and that helps to preserve and maintain that environment so that there's less complications after the cross-linking procedure. He was also very gracious and gave us a lot of different handouts and resources. So if you want to use those, they're free on our website on wuu.org/Keratoconus Symposium. He had some free handouts and really great resources for our practice. We then heard from Dr. Connolly on behalf of Glaukos, which was really interesting because he is not only an optometrist, but he is an attorney as well. And it was really interesting to hear from him. Not only did he personally share his story about corneal cross-linking, he had a procedure done that was not FDA approved, and he had a lot of complications. It was actually a really scary story, and just interesting to hear from somebody who's actually undergone a type of surgery that was not FDA approved, and some of the issues that it can cause. And he also went into kind of talking about what are the responsibilities of the eye care professional if the patient doesn't undergo an FDA-approved procedure. So that was incredibly interesting. Definitely check that out if you have any questions on litigation or attorney things and just using things off-label. Really, really interesting information. We then heard from Dr. John Gelles, and he gave us some updates on corneal cross-linking. So there is an FDA-approved option for cross-linking. It's epithelium off, but there's also some things in the pipeline that are going to be approved sometime in the near future that are epi on. So he talks about a lot of the different FDA clinical trials and things that were used to get corneal cross-linking approved in the United States, and then also what is to come. And then last, we heard from Dr. Elise Kramer. She gave us an incredible amount of resources for keratoconus patients. One of the key things that she talked about was the National Keratoconus Foundation. It's a nonprofit organization that's committed to helping keratoconus patients get accurate information. So she hands out a pamphlet that is from the NKCF, which has information on what keratoconus is, what are the different treatment options, how to find a great doctor. So those were really, really incredible resources that I think a lot of doctors maybe don't know exist. So that was another thing that I think was incredibly helpful to doctors all over the world to find out some of these options that patients have as far as really high quality resources so that they can understand the disease and understand their best treatment options. So again, thanks to everybody that participated. We had over 2,600 eye doctors register for the event, and it was our biggest event to date. And Dr. Sorenzi is going to be giving a recap on day 2 of the Keratoconus Symposium. So again, my name is Dr. Stephanie Wu, and I hope that you enjoyed these pearls from day 1, and we'll see you next time.